the topic for today is iron and anxiety. Now, many people suffer from anxiety, and anxiety is a non-specific symptom, which means just because someone says they have anxiety or is diagnosed with anxiety, that doesn't mean you know where the anxiety is coming from. So if I surveyed the listeners out there and said, what do you think of when you hear anxiety? Most people would probably say, psychology or the brain or something in your head, right? Because anxiety, depression, those are mood or neurocognitive issues. And so most people say, well, the cause is probably in the head. And conventional medicine has brainwashed people to think that, because what's the treatment for anxiety or depression? SSRIs or some sort of psychiatric medication. But a non-specific symptom means you don't know where the cause is coming from. You could be anxious because you've been abused in the past. You could be anxious because your blood sugar is low. You could be anxious because you have a test coming up later today. So the cause of anxiety, the causes are many, and just hearing anxiety doesn't tell us where the cause is coming from. So today, the cause I want to talk about is iron status. And as we dive in, I want to say, don't make any changes based on this presentation without first speaking with your primary care provider. All info in this call is accurate to the best of our ability at the time of recording. If you're watching this in the future, make sure you look for updated information. So in order to understand anxiety and iron status, we have to understand the brain a little bit. And so this image comes from functional neurology seminars in 2016 from Drs. Datis Karazi and Brandon Brock. And I'm thankful for them and all the work that they do. And so if you look on the left-hand side of this diagram, you can see a healthy neuron resting membrane potential. A neuron is a brain cell, right? And a healthy neuron, when it's not working, when you're not thinking or reaching for your glass of water or doing some sort of nervous system activity, the brain cell is at rest at negative 70 millivolts. Now, if you look up above that, you see at negative 40 millivolts, there's a threshold. For the neuron to fire and create an action potential to talk to the next neuron and the next neuron so that you can reach for your glass of water, or you can speak to your spouse, or you can, go running, the resting membrane potential must increase up above that negative 40 millivolts, break that threshold, and then you have the action potential. And then you have the thought or the movement. Well, why is that important? Well, because a healthy resting membrane potential is negative 70. And health, as it pertains to brains or neurons, requires optimal ATP or energy status. And healthy energy, healthy ATP levels depend on healthy mitochondria, which are the powerhouses of your cells, and in this case, your neurons. Well, mitochondria require oxygen delivery, healthy blood sugar, stimulation, movement, learning, instruments, that sort of thing, and healthy inflammatory levels or oxidative stress levels, antioxidants, that sort of thing. So if all is good, then the brain is healthy and the neurons function well. If you look over on the right side of the diagram, if the resting membrane potential at baseline is higher than negative 70, right? If it's up here at around negative 50, then it takes less to cross that threshold, right? So the neuron is at a higher resting state. It's closer to firing. And so what might that look like clinically? Maybe that looks like a tic or a headache or anxiety or some sort of abnormality or symptom, okay? And why does this happen? Well, this happens because of poor energy supply due to potentially low oxygen delivery to the brain, maybe because of poor circulation or atherosclerosis, maybe because of anemia. Maybe it's happening because there's poor blood sugar levels. due to blood sugar that's too low, like a hangry Snickers commercial type deal, or blood sugar that's too high because of insulin resistance or diabetes. Maybe the membrane potential is elevated because of a sedentary lifestyle. Someone doesn't exercise, or someone's immobilized due to injury or amputation or something. Or perhaps there's an imbalance in inflammation. Maybe they're inflamed, or maybe they're rusty because of oxidative stress. And so what I want to talk about today, the one cause I want to talk about today is the oxidative stress part as it relates to iron, specifically iron that's too high. If your iron's too low, most people recognize that as it drives fatigue. Well, if your iron's too high, that drives oxidative stress or rust, right? If you have a steel bumper on your car and you leave the car outside over time, the bumper oxidizes or rusts. So that's the metaphor for oxidative stress in our body. We rust if we have too high oxidative stress and not a high enough level of antioxidants. So iron that's high promotes rust, and high iron promotes damage to our neurons, unhealthy resting membrane potential, and takes us closer to anxiety symptoms or a headache or whatever we're talking about. But today it's anxiety. So let's dive in. Here's a study that's titled Iron Overload and Psychiatric Illness. And this was a case study looking at 7 patients with varying psychiatric disorders. And they were found to have iron overload. And iron overload is recognized by high serum ferritin, high transferrin saturation or iron saturation, or excessive urinary iron. So the easiest thing to do would be for your doctor to run an iron panel, which is not standard in conventional medicine. They like to use hemoglobin to determine your iron levels, but you can be fooled by that. So the best thing to do would be to run an iron panel and look at this, look at the serum iron, look at the ferritin, look at the transferrin saturation. If those are high, that's iron overload. Well, does that matter? Well, yes, in certain patients it does. These 7 patients had psychiatric disorders, and it was due to disordered iron metabolism, okay, or iron overload. And that iron overload was the somatic cause or the metabolic cause of psychiatric illness. And these people experienced clinical improvement once they lowered their iron levels, okay? So I don't know about you, but I don't know anyone personally who's ever gone to their doctor with anxiety and had an iron level drawn before they were given, Prozac or Xanax or whatever drug the doctor was giving out. So if a person has psychiatric illness because of iron overload and that isn't investigated and they're put on an SSRI medication, they're going to be one of the high numbers of people that don't improve on that medication. Why? Because the detective work wasn't done. The specificity wasn't used to determine what's the cause of their anxiety, because anxiety in the office that they went to wasn't seen as a non-specific symptom. It was, they were practicing assumption medicine. They hear anxiety and they say, oh, take this medication. We don't want to do that. We want to be specific to each person. That way we can help them. This study, called Iron and Mechanisms of Emotional Behavior, tells you iron deficiency results in poor brain myelination and impaired neurotransmitter metabolism. That's iron deficiency. Glutamate and GABA homeostasis is modified by changes in brain iron status. Such changes produce not only deficits in memory and learning and motor skills, but also emotional and psychological problems. Why? Well, because energy metabolism and neurotransmitter balance influence emotional behavior, and both of those are influenced by brain iron status, right? Energy metabolism, right here, mitochondrial health, okay? Influenced by brain iron status, because iron carries oxygen. Oxygen becomes energy. That's one reason, but then too much iron drives oxidative stress or rust. So that's another reason brain iron status influences emotional behavior. And so this study went on to look at its impact on anxiety and all kinds of other issues. So it's known and established in the research that high iron drives, well, iron dysfunction in any direction, low iron or high iron, drives emotional issues, neurotransmitter issues, and anxiety. But this video today is specifically looking at iron that's too high. So what can we do about it? Well, you know, if the iron overload is due to a disease like hereditary hemochromatosis, that's a genetic disease that the gold standard treatment for that is therapeutic phlebotomy, meaning you have to go give blood every so often to drain off the iron. If you don't, the oxidative stress ages you too soon and you die younger. 65 years old, I believe, is the average life expectancy for people with hereditary hemochromatosis. That is unrecognized. But say you don't have a genetic iron overload issue. Say you have iron overload because of exposure environmentally or in the workplace or nutritionally, or you're just not clearing it. Well, then you can have anxiety and these other issues on a level that's lower than hemochromatosis, but still affects quality of life and overall health. So what do we want to do? We want to lower iron through lifestyle, through supplements, things like that. What are useful things to help with that? Well, this study shows that Neurogenin mitigates iron-induced anxiety, mitochondrial dysfunction, so powerhouse energy issues, and acetylcholinesterase issues in the rat hippocampus. Well, the hippocampus is the part of the brain that is short-term memory, and from there goes into long-term memory. The hippocampus is also the part of the brain that sets your circadian rhythms for hormones, specifically cortisol. So if high iron destroys the hippocampus and drives anxiety, then we want to stop that, right? Because anxiety is one potential outcome. Neurodegeneration is another. So Parkinson's disease, Alzheimer's, dementia. In Alzheimer's, you're losing the hippocampus. So dementia is a hippocampal issue. High iron can exacerbate that. And depending on your uniqueness, maybe you lose the hippocampus and develop Alzheimer's. Maybe I lose frontal lobes and develop anxiety. So it depends on what brain regions the high iron is impacting. But anyway, this study is looking at Neurogenin, which can mitigate the iron-induced anxiety and other issues. So Neurogenin is an iron chelating antioxidant that restores brain dysfunction induced by iron toxicity. Neurogenin is a natural flavonoid found in citrus fruit peels. So your oranges, your grapefruit, your lemons, your limes. And what the study showed was that using Neurogenin significantly ameliorated the anxiety-like behavior caused by high iron levels. So this is a natural thing in citrus fruits that we can use to reverse anxiety that's induced by high iron. And they close by saying the neuroprotective role of Neurogenin in human health can help prevent brain injury associated with iron overload. So when you're making your meals for Thanksgiving coming up or anytime during the year, using the peels can be beneficial as well, not just the fruit that's inside it. And then this study shows that cannabidiol or CBD oil can also be neuroprotective against iron overload in the brain. And so this study says things that we've already said, but cognitive dysfunction is associated with iron excess in brains of humans. They've shown that iron overload leads to severe memory deficits, memory issues, including spatial, recognition, and emotional memory impairments. So spatial memory impairment would be, oh, I want to go to the store, but I can't remember how to get there, okay? Or where did I leave my keys or my wallet? Recognition memory would be, you know, oh, that's my nephew Johnny. I recognize him, right? And emotional memory impairments, you know, can be anxiety, depression, those sorts of things. So CBD is the main, you know, the main non-psychotropic component of marijuana, and it's been shown in the research to reverse all the iron-induced effects to the point that people who are damaged by high iron, when they use the CBD oil, they reverse those effects so that those people went back to the levels found in the control group. So the control group is the people that didn't have high iron-induced damage. And so the iron-damaged people that use CBD oil recovered to the point that they looked like the control group, which is awesome and which is powerful. And so again, the conclusion is the reversal of iron-induced effects by CBD indicates that it has neuroprotective potential for the brain and iron overload. So if you're out there suffering with anxiety and you've never been helped by an by a psychiatric medication of any kind, perhaps it's because your cause to your anxiety hasn't been found, and perhaps iron overload is your cause. If you want to see stories of real people that have healed from anxiety, here's a small sample of testimonial videos you could see on my YouTube channel. And not all these cases were due to iron overload, but I just want you to understand that anxiety can be helped naturally. And the key, again, is to find the cause, whether it's iron overload or blood sugar or gut or whatever. If you find the cause, you can create the solution. And if you'd like to learn more about anxiety in the brain and iron's role, then you can watch my videos on YouTube where I'm explaining mechanisms. I discuss it in chapter 1 of my book in regards to a Parkinson's disease, because high iron drives neurodegeneration. And so those resources are available to you as well. And I look forward to hearing testimonials from those out there that consume this content, discover that their anxiety was related to iron, and share with me how they reduce that iron.